Welcome to Optonome CEO Corner. I'm your host, Dennis Dicker. Today we'll be going over how we got here with Shainna Young, CEO Corner with Shainna, a case study with Ricardo, community participation with Shainna, and a demo showing you how to register and access chat in the Optonome application. Thank you. It should be live.
Yeah. Yep, I see that we're streaming. Hi, everyone. Thanks for joining. It's actually...
Hi, everybody. Thanks for joining.
Yeah. I think today's like a very great discussion. We haven't chatted with Dennis in a while, so I'd like to bring him on during this time. I know there's a lot going on, and I really wanted to have this interview to answer some of your questions, but also just really talk about what the purpose of Optonome is and what Dennis's long-term goal with Optonome and creating equal opportunity for everyone. So I'd like to introduce you to Dennis. This is a man that is changing home healthcare for the better and really breaking and shifting the paradigm of what home healthcare is right now in terms of just home healthcare in general, but also like the whole gamut. We're talking about the direct support professionals, we're talking about the CEOs, the healthcare providers, and the consumers, our adults with disabilities and older adults. So Dennis, why don't you introduce yourself, talk about maybe a little bit where you're at right now. Like, I guess like people, I did have someone ask like, you're local, you're in the Philadelphia area. You've always been in Philadelphia, so why don't you just chat about that?
Okay, sure. Thanks for joining, everybody. This is a pretty big topic, as you can see. It's flooding the news. As far as my history, my family, my parents are from West Africa, and I moved here in the 70s. My dad, he was a chef on a ship for Ghana. He was a lead chef as they dropped off cocoa around the world. So he decided to start his family here in the States, where he felt that they would get the best opportunities. He lived all over the world, so he decided to settle here in the States. So most of my years have been in the Philadelphia area until I graduated. And then at that time, when I graduated from college, I decided to get away, which I asked most people to do. Get away from home, really learn yourself. And so that's when I moved to the DC area, where I really got a chance to see what life is like outside of my hometown. And that really opened up my eyes as far as real estate, as far as education, and because in the DC area, you kind of, once you live there, you kind of can see why Amazon chose that area. Nothing but really bright people, really motivated to do great things in the area. So it's a great place to be. So I was there for about 7 years, where part of that time I decided to move back to the Philadelphia area to start my agency, because what I learned was, okay, I'm going at this trajectory like this, and most of my friends are going like this. And it was kind of interesting that they really didn't have I wouldn't say a path. It wasn't a clear path. Most people in these schools in the Philadelphia area are not really guided properly, so they don't really know about the different opportunities after school, or all they know is drugs or some type of quick scheme to make some money. Unfortunately, that's all they know. And for those reasons, that's kind of what's coming to light, how they got in this. So that's kind of like where we are right now.
Wow, that's actually, I learned something. So before we continue, can you guys just say quality is good, like you guys can hear us well? I know that Teresa, Christine, Donna, and Yolanda are on, but can you guys just let us know that you can hear us clearly? Because I just want to make sure that you can get all this information. But so Dennis, if I'm correct, you were actually born in Ghana and then moved over here?
I was born in Philadelphia.
Oh, okay. So your dad moved over here in the 70s. I didn't catch that at first.
Yep. We got a first prop. They bought a house in University City of Philadelphia, where I was fortunate enough while in college to create a savings and actually purchase the home. My mother passed away when I was 16, and so it was just my dad. So I needed to really help him retire. He didn't really have a savings because most of his life he was making probably $13 an hour, probably max. So I wanted to give him a chance to retire and not have as much stress as he did when he was working. So I decided to purchase a home from him. That way he had some money because most of the time while raising me, they were paying a mortgage. So I was able to purchase the property of $65,000 back in 2005. And I did it because I knew that either I could rent the rooms or worst case scenario, I could sell it. Even though it's a family home, I wouldn't sell it, but I knew there was value there. And I quickly learned that because of where you live, they can actually lower the price of your home. And I didn't think that was possible, but my property was like right on the border, even though it was maybe 2 minutes from the University of Penn. They wouldn't up the value of the price because the area was surrounded by lower income families. So if you are familiar with real estate, if one property gets sold or refinanced at a certain price, everybody on that block or everybody in that area with a similar home, they're able to also do the same thing. So that's why there's a lot of red tape or redlining of real estate in lower income neighborhoods.
Yeah. And just talking about that too, if you wanted to get a little further in depth, like because I remember you telling me the story and you really had to advocate and you really had to go to other banks in order to fight for the property value, right? Because of the area that I was in.
Yeah. And as far as banks, they are not your friend, especially minorities. They would quickly deny you for a loan, even if you show that you could pay for it. If you have a commercial property, this was really the case way back then. So that's why there were a lot of no-doc loans at the time, and that was also the reason why there was an economic downturn during that time. But back to your question, yeah, I've been through it. Many banks denied me. I was fortunate enough to establish a relationship with a local community credit union, and he really guided me because I had a mentor in my uncle that was in real estate, and he just said, Dennis, take your time with real estate, purchase one at a time. But at the same time, I had to make sure I can get a loan. But the hard part is you can't get a loan from a bank. So I was able to figure out a way to not just work, take a portion of student loans. A lot of people didn't know that it's their money when you take out that loan. It's supposed to go towards housing and school. So I used that to help with my housing. And it went towards my developing or creating some type of opportunity for myself at that time.
And I could be wrong, and you could fill in a little bit more, but I think a lot of that comes from your mom. Your mom sounded like, you developed a lot of your skill set and your hard work and motivation and dedication from her, right?
Right, good question. So one of the first lives I did was really talking about small business and how I started maybe mid-90s while working at her store. I was maybe 10, 12 years old, and my first job was really helping professionals by typing up their resume. So many professionals would come to me and I would type up their resume. I was about 12 years old at the time. But I was able to really see and get an in-depth look at their experience, and I learned a lot from that aspect, as well as actual small business every day, coming to the store, do inventory, and that's what helped me start and create a website for her store to help her sell more items. So that was pretty much my early teenage years where I learned a lot of small business and really the struggle of it and finding new customers.
Yeah. But I really see it as a beautiful thing how your mom helped teach you these entrepreneur skills, and your dad, who I've met and is a really great guy, seems like he always has a smile on his face when I see him, with his hard work to, do better and bring, your family over here and lead this successful life that was a journey to get to. But I also find that amazing. I didn't realize that you bought the house for your dad. Like, that must have been the best feeling in the world.
Yeah, it was. I mean, I loved it just to give him an opportunity to live out, his retired days, to do whatever he wants. If he wants to buy a car or whatever he wants, he put the time in. So why not?
Yeah, that's amazing. So let's start to dig into autonomy, because I have some questions I'd like to get into, and one of them is, you built autonomy because you created your own home healthcare agency. But I guess starting out, like, what issues did you see prior to, I guess, let's say or maybe I'll throw it out there for you. So when you started your agency, was there anything prior that you saw before starting your agency that you saw as like an injustice or inequality that you were hoping to change? And then once you did start your agency, did you find something else different? Again, any injustice or inequality that you wanted to change?
The only I don't know if I would call injustice, but I did see that the people that lived in the lower income neighborhoods, they didn't have, or they didn't know that there were opportunities out there that they could pursue. The path wasn't clear for them. So, and their family members didn't really know the path because most of them didn't graduate from college. So they were kind of lost after high school, or even probably already from high school, and they probably already had a criminal record by the time they graduated high school. So by the time they graduated high school, it was kind of too late. So what I wanted to do was, I knew that I was an expert in computers. I know nobody could tell me otherwise, because at the time I was working for the federal government. So I knew that I could teach anybody about how to use a tool, technology, to better themselves, to upskill themselves, or use it to their advantage, so that they could become proficient in the workplace or introduce a new way to do something for their employer. In the early to mid 2010, 2015, a lot was changing with technology, and it didn't really hit mainstream yet. So I knew there was a lot of time in between before, if I was able to teach people that their skills would be used for many years to come. So I was confident in that. That's why I pursued it.
Yeah, could you talk a little bit about, what you did with Philadelphia Works? Because one thing in terms of Philadelphia is that job opportunity and good, or livable wages and things like that. Could you talk about the study or the research that you were in with Philadelphia Works?
Sure. So every county has this, and it helps people that are currently unemployed to be able to gain some type of skill, maybe over a 6 to 12-month period that they could use for years to come, and to help them get a more livable wage. And again, that's why I chose healthcare, because I knew that I could bring some type of technology solution that, when used in the healthcare setting, could be utilized for many years to come. So that's the reason why Philadelphia Works started a partnership where at the time we said, hey, look, we have about $800,000. We need more training programs. And I said, whoa, I built this training program to help people because more people need to be trained in healthcare and technology, as well as managing their home. A lot of people, DSPs as well, didn't know how to properly manage their home. So I felt like I did have a solution, and that's when Philadelphia Works. We were able to have a contract where anybody that's trained during the 6-month period, they would pay 50% of their pay. And that's just so that they could focus on, or the employer could focus on training them and helping them get more skilled in the workplace. So that definitely helped me focus on the training aspect and really put it together where some type of third party would really approve of it. So that was a pretty cool partnership there.
Yeah, definitely. And so, you established your agency. You were doing very well. You grew your company from, when you started out from 35,000 to 1.6 million. You were providing opportunities for DSPs. Consumers were doing very well. But what made you jump from saying, you know what, I want to do more than just my agency. I want to now go nationwide. I want to scale this. What was the reason?
Good question. All right. So as far as autonomy, the goal is optimum autonomy. So I knew that sooner or later I would have kids. I knew that there are people in my life that I would want the best for. And just like families that have a loved one that's diagnosed with some type of disability or disorder, it's an unexpected event. And just when you're raising a child, you have unexpected events. So I wanted to put something in place that if in my own family there's an unexpected event, kind of like when my mother passed away, that's an unexpected event that changes the whole dynamic of the family. I wanted to have something in place that could continue to help the family build some type of wealth for years, generational wealth. And I felt that there's really nothing out there that can offer that, especially for minorities that really don't have family that have been to that level of education or that level of some type of owning a home or being able to pass a home down to your loved ones. So I wanted to build something that I knew could really help people for years to come. So that's why I really pursued this.
Yeah, definitely, to create a change for your family, and also too, I definitely remember you saying with other agencies that you were seeing neglect happening with other agencies. I don't know, did you witness abuse with other agencies, or did you just see like the fraud that was happening with other companies?
Well, yeah, it still happens today, and it's unfortunately it falls on the DSP, and it's because of the systems that these agencies put in place, and it falls on these lower income individuals all the time. You could look at every story that there's some type of neglect, abuse, or fraud. There's always somebody that's probably a lower income worker that the blame is put on. So that's really the case. So I wanted to, again, put something in place to help people, everybody excel, from the top all the way down to the person that's actually doing the service. If there's a better system up top, then it will trickle down to the actual DSP or the care worker, so that if there's any allegation of abuse, neglect, or fraud, we're able to actually clearly see where the problem is and fix that problem as soon as possible.
Yeah. And that's what also gets me excited too, that I feel that you're empowering, you're empowering us as the CEOs because you're putting the healthcare professional first and we're actually doing value care. But like the DSPs, the traditional model has been, they've been stuck, they've been underpaid, and they have no room for growth. And you're saying, hey, you can be an entrepreneur, let me give you the training that you need. And when you want to do it, like you give them that option. And I think that is such a new thing that's going to revolutionize home health care and really start to empower the DSPs to think, I don't just have to be in this position. I can also do other roles, and I can own my own agent. I can own my own company. And, I find that a very big deal for them.
Right. And there's room for everybody. That's what we want, right? There's plenty of room, no matter your background, where you started, your pigmentation. There's room in healthcare for plenty of DSPs to learn how to become a successful entrepreneur, because there's such a huge need for support services. And so with Optonome, you have no choice but to excel. You're continuously trained. You have mentors, clinicians, over 90, and growing. So it's a feedback that you benefit from no matter what. You just have to put in the effort.
Mm-hmm. Yeah. And I think that leads into the question that people were asking, which is, what is your goal with Optonome for healthcare providers? We talked about the DSPs just now. Let's focus, I guess, what is your goal with healthcare providers with Optonome?
Yeah, so the number one goal is to create some type of sustainable solution for support services long term. It's currently absent right now. It's sickening, it's scary to actually think about what will happen to your loved one if something happens to you. It's very scary. These current agencies out here, they're unpredictable. You don't know if they're going to stay open. You don't know what type of staff are going to come through those doors. You don't know what type of training they received. So the goal of Optonome is to just create a standard that everybody can understand. Again, like a driver's license, so that they can trust it, and they could know that no matter what, there's a local clinician that is an expert. They'll continuously provide some type of clinical oversight, and they're experts, so they're not going to just unwillingly say things or do things, and have the ability to connect with either your insurance or anybody else to get further help if needed.
Mm-hmm. Definitely, I agree. I find this very empowering, and I've said this before, but I just feel like when I tell people about it, I'm proud. I'm proud that I'm actually going to do what I was meant to go to school for as an OT. I'm like legit doing occupation-based skills, and that just gets me really excited. And to have you that essentially put that into my life just makes me that much more appreciative, because like I said, you could have kept this as your own agency and done really well, but you scaled it and made it nationwide, which just is more value change and more healthcare that's going to really impact people for the better.
Well, yep. People ask me all the time, why didn't you just keep it to yourself? It's so greedy, and that doesn't really solve the overall problem at all. There's a bigger problem at hand.
Yeah, I mean, personally, I recently did a per diem home healthcare agency job, and they tried to make me commit fraud. That was my first home healthcare experience. And my first job, they tried to make me commit fraud, which was just crazy. And then, in terms of COVID, I just got off, this week I was talking to a potential family, where that person may be in the future, like one of our clients. And he was saying, hey, my whole family got COVID. My wife, me, and my daughter who has disabilities. And that was the breaking straw of me realizing, where is my daughter going to go after I pass away or something bad happens. So, I think this is a very important time that this is coming out, because especially now with just parents with disabilities, they're really thinking that during this time, this pandemic, it's a really scary time for them, and they really want someone to be there and actually provide good quality care for their kids who are adults now.
Right.
When working with Ricardo, if it is his goal to make more friends, we would use his strengths and preferences to identify organizations or groups or clubs that he would want to participate in because they're doing things that he likes. For example, if Ricardo enjoys card games and tabletop gaming, such as Magic the Gathering or Pokemon or Dungeons and Dragons or something like that, we would help him find a gaming store, which usually hold weekly events for these things, and schedule him to go to attend the events that he wants to attend. Direct support professional would go with him, and we'd work on the skills that he needs to build friends. For Ricardo, some of the difficult things are when he feels he's being lied to, when somebody disagrees with him, and also when there's loud noises. One of the functional communication skills that we teach when someone is distressed is to ask for help. So if someone is disagreeing with Ricardo, or he feels like they're disagreeing with him, we'd work with Ricardo to be able to ask someone, either the direct support professional or ideally the other person in the conversation, to help him by providing a little more context, rationale, logic behind their decision, and maybe this would help him understand their point of view as it relates to him. Also, same exact thing when he feels somebody is lying to him. We would want him to ask for help, ask for assistance, ask for clarification from the other individual. So we would essentially prompt Ricardo to ask for assistance or ask for help, ask for clarification. And then as he begins to do that more and more with prompting, we would fade the prompting out, because again, it is really, really important to constantly be thinking, oh, how do we fade this prompting out so that the person we serve can use their skills independently. So overall, we would help Ricardo identify some community activities that he likes, help him schedule and attend those activities, and then work on some of the skills that Ricardo needs to be able to thrive and make more friends. And in this case, that would be asking for clarification, asking for help, asking for assistance, and also tolerating loud noises in a group environment. Again, asking for help or assistance is a perfect replacement skill to start when helping somebody develop functional communication that replaces some of the more challenging behavior.